Acronyms are everywhere in health insurance. And unless you know what they stand for, trying to understand insurance quickly turns into translating hieroglyphics. Take, for instance, the commonly used terms HMO and PPO. What do they mean? PPO stands for Preferred Provider Organization, and HMO stands for Health Maintenance Organization. Both are types of health insurance plans with different benefits. Usually, the primary thought when comparing these two terms concerns their differing prices. Two additional terms that are crucial to understanding HMO and PPO plans are in-network and out-of-network. Doctors and their staff will form close-knit healthcare teams known as networks. The participants within these networks will prioritize each other's businesses by referring patients to one another. Being part of a network legitimizes one's medical practice and opens doors for new and diverse patients to get treatment. With an HMO, doctors expect patients to seek treatment only from the doctors and facilities teamed up with their provider, or the ones that are in-network. These networks may be small, meaning your choices are limited in who can treat you, even in emergencies. If you go out of network and visit a doctor or clinic outside of your plan, your insurance will not help you pay for the cost of your treatment. Benefits are in-network only. With a PPO plan, patients may choose to see doctors or visit facilities that are either in-network or out-of-network. The biggest benefit of a PPO plan is that networks are typically larger, and your insurance will help pay for your care no matter who you see or where you go. You can get treated almost anywhere, and rest assured that you will be covered. You may pay more for out-of-network care than in-network care, but you'll still receive financial help from your insurance company. Another significant difference between HMO and PPO plans is the implementation of primary care physicians, otherwise called PCPs. PCPs receive training to examine patients generally, doing whole-body checkups to glean information and make diagnoses. After a holistic examination, they coordinate care between patients and specialists to ensure specific ailments are addressed. If you have an HMO plan, you are required to have a PCP. From the moment of application, your PCP becomes your doorway for receiving health treatments. To be covered, you must make your appointment with your PCP when you first notice an issue or illness. From there, they'll perform an examination, and based on their deductions, will provide general treatment or refer you to an in-network specialist for further care. Specialists are doctors whose focus lies in a specific field or area of the body. An example would be a cardiologist or a heart doctor. In many cases, a written or electronic referral from a PCP is a prerequisite to receiving any specialist treatment. So, no referral, no treatment. If you have a PPO plan, you do not have to have a PCP. You can see any provider or specialist that you want, wherever you want. Copay and coinsurance rates will vary based on whether you go in-network or out-of-network for your care, but your insurance will kick in no matter what. Again, the trade-off for flexible, speedy, specific care is that PPOs are much pricier than HMOs. Here's a simple table breaking down the main differences between PPOs and HMOs, and why their prices vary so much. PPOs have bigger networks, while HMOs have smaller networks. PPOs allow you to see any hospital, doctor, or specialist, while HMOs are limited to a select number of doctors. PPOs offer both in-network and out-of-network coverage, while HMOs only offer coverage in-network, except for life-threatening emergencies. Those are the basics of HMOs and PPOs. But if you'd like more help understanding the differences, give us a call at 888-539-1633. And we'll see that all your questions are answered. And as always, if you're interested in empowering yourself and taking control of your situation, subscribe to our channel and put more health, life, and financial tips on your radar. Thanks, everyone.